Are you spotting in your first trimester and worried about a miscarriage? This can be a distressing experience, particularly for those who are pregnant for the first time. But let's take a deep breath and delve into this topic to understand it better. Spotting in the first trimester is actually quite common, occurring in about 1 in 4 pregnancies. So, if you're noticing a bit of light bleeding, know that you're not alone. It's not always a sign of something serious, and in fact, many women who spot during their first trimester go on to have healthy pregnancies. But what exactly is spotting? Well, it's a slight bleeding that's usually lighter than what you'd see with a regular menstrual period. It can range in color from pink to red to brown, and it's often so light that it doesn't require a pad or tampon. In contrast, menstrual bleeding is typically heavier and requires the use of sanitary products. Spotting can be caused by numerous factors such as implantation of the embryo into the uterine wall, changes in the cervix, or even after a pelvic exam or intercourse. It's also worth noting that spotting isn't exclusive to the first trimester. It can happen at any point during pregnancy, but it's particularly common in the early stages. That being said, it's natural to feel concerned if you're spotting during your pregnancy. It's a good idea to keep track of when it happens, how much you're bleeding, and the color. This information can be helpful if you choose to discuss it with your healthcare provider. But here's the key takeaway. Spotting during the first trimester is not automatically a sign of miscarriage. While it's a potential symptom, it's only one of many, and it's often accompanied by other signs such as severe cramping or pain. While spotting can be alarming, it's important to remember that it's quite common and doesn't always signify a problem. So take a moment, breathe, and remember that every pregnancy is unique. You're doing great, and you're not alone in this journey. Recognizing the signs of a miscarriage can help alleviate some of the worry and uncertainty. One of the most common signs of a miscarriage is heavy bleeding. This is not to be confused with spotting or light bleeding that can occur in the first trimester. Heavy bleeding is more persistent and may come with clots or tissue passing from the vagina. It's important to note that while heavy bleeding can be a sign of miscarriage, it doesn't always mean that a miscarriage is happening. Other issues like subchorionic hemorrhages can also cause heavy bleeding during pregnancy. Severe cramping is another sign that could indicate a miscarriage. While mild cramps can be a normal part of pregnancy as your body adjusts to its new state, severe cramps that persist and increase in intensity could be a cause for concern. These cramps might feel similar to strong menstrual pains, and they could be accompanied by lower back pain. The passing of tissue is a more definitive sign of a miscarriage. This tissue might look like large, heavy clots, or it could have a grayish color. It's different from the typical clots that might be passed during heavy bleeding. If you notice this, it's important to contact your healthcare provider immediately. A sudden disappearance of pregnancy symptoms can also be a sign of a miscarriage. If you've been experiencing symptoms like morning sickness, tender breasts, or fatigue, and then suddenly they stop, it could be a sign that hormone levels are dropping. However, it's important to remember that symptoms can also fluctuate during a healthy pregnancy, so this isn't a sure sign of a miscarriage. Knowing these signs can help you identify when something isn't right and when you need to seek immediate medical attention. It's important to remember that every woman's body is unique, and every pregnancy is different. If you're ever in doubt about your symptoms or if something doesn't feel right, always reach out to your healthcare provider. They are there to support you through your journey and will be able to provide the best advice based on your individual circumstances. So, when should you reach out to a healthcare provider? Well, that's a question that deserves careful consideration. It's important to remember that every pregnancy is unique, and what might be normal for one person could be a cause for concern for another. Let's say you're experiencing spotting. It's light, irregular, and doesn't come with any other symptoms. In many cases, this can be a normal part of early pregnancy. But if you're worried, it's never a bad idea to reach out to your healthcare provider for reassurance. Now, if that spotting starts to get heavier, or if it turns into bleeding that's similar to a regular period, that's a clear sign that it's time to seek medical help. Even if it's not indicative of a miscarriage, heavy bleeding could be a sign of other complications that need to be addressed. Severe cramping is another red flag. A little discomfort is to be expected as your body adjusts to pregnancy, but severe or persistent pain should always be checked out. It could be indicative of an ectopic pregnancy, which is a serious, life-threatening condition that requires immediate attention. Other symptoms that warrant a call or visit to your healthcare provider include passing tissue or clots, dizziness, fainting, or feeling generally unwell. These could be signs of a miscarriage or other serious complications and should never be ignored. And then there are the less tangible signs. Maybe you just have a feeling that something's not right. Perhaps you're feeling unusually tired, or you're experiencing a sudden decrease in pregnancy symptoms. These could be perfectly normal, or they could be your body's way of telling you that something's off. The bottom line is this: if you're unsure, get in touch with a healthcare professional. It's their job to help you navigate these uncertainties and to ensure the health and well-being of both you and your baby. Remember, it's always better to be safe and seek help if you're unsure. Trust your instincts, listen to your body, and don't hesitate to ask for help. It's natural to worry about miscarriage, especially if you're experiencing spotting. The fear of miscarriage is a common concern among expectant mothers, especially when there's spotting involved. It's a topic that's often shrouded in silence, creating a sense of isolation. However, it's important to remember that you are not alone in this journey. One of the first steps to coping with this fear is to talk to your healthcare provider. They can provide you with accurate information about your symptoms and what they might mean. They can also offer reassurance based on their professional experience. This can help to alleviate some of the fear and uncertainty you may be feeling. Remember, knowledge is power. The more you understand about your situation, the better equipped you will be to cope with whatever comes your way. Another crucial step is to seek support from your loved ones. This could be a partner, a family member, or a close friend. Share your fears and anxieties with them. You may find that they too have their own experiences and insights to share. You might also consider joining a support group, either in person or online, where you can connect with other women who are going through the same experience. Practicing self-care is also essential. This can mean different things to different people. For some, it might involve taking a relaxing bath or reading a good book. For others, it might mean going for a walk, practicing mindfulness, or meditating. Whatever it is that helps you relax and focus on the present moment, make sure to make time for it. Finally, remember to be gentle with yourself. Fear and worry are natural reactions to uncertainty. It's okay to feel scared. It's okay to feel worried. What's important is that you acknowledge these feelings and then take steps to cope with them in a healthy way. Fear and worry are natural, but remember, you're not alone and support is available. Let's recap what we've learned today. We've journeyed together through a topic that, while delicate, is crucial for many to understand. We started off by exploring the phenomenon of spotting in the first trimester. We learned that spotting can be a perfectly normal part of early pregnancy. It's something that a good number of women experience. We then delved into the signs of a miscarriage. These can include heavy bleeding, often accompanied by cramps, and sometimes the passing of tissue or clot-like material. We emphasized that experiencing such symptoms doesn't automatically mean a miscarriage is occurring, but they are signs that should prompt immediate medical attention. Next, we highlighted the importance of seeking medical help when these signs are present. Your healthcare provider is equipped with the knowledge and tools to give you the best advice in such situations. They can guide you, provide necessary medical intervention, and offer emotional support. Finally, we touched on coping with the fear of miscarriage. It's completely normal to feel anxious or worried during early pregnancy, especially if you've experienced a miscarriage before. But remember, every pregnancy is unique, and a past miscarriage does not necessarily predict future outcomes. Throughout all of this, the key takeaway is that while spotting can indeed be a sign of a miscarriage, it's also a common occurrence in many healthy pregnancies. It's important not to jump to conclusions or let worry overshadow the joy of this special time. Educating ourselves about these topics can help alleviate some of the fear and uncertainty. So continue to seek out knowledge, ask questions, and most importantly, keep open lines of communication with your healthcare provider. They're a vital resource on this journey. If you're spotting and worried, reach out to your healthcare provider. They're there to help and guide you through this journey. As we wrap up today's journey, remember that knowledge is power. Taking the time to understand your body, its signs, and how to communicate effectively with your healthcare provider can make all the difference. You're not alone in this journey, and there's a whole community here to support you. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more health-related content. We're here to provide you with the information you need to navigate your health journey with confidence and peace of mind. Remember, every person and every pregnancy is unique. You are your own best advocate, and with the right information, you can navigate any challenges that come your way. Thank you for joining us today, and we look forward to seeing you in our next video.